Welcome to SimplyRN. Today we will go over peripheral artery disease, or PAD. PAD is narrowing of the arteries, usually in the lower extremities, due to atherosclerosis. Remember, atherosclerosis is a plaque that is formed from cholesterol and fat, and it blocks blood flow in arteries, resulting in decreased perfusion. Signs and symptoms. Intermittent claudication is a hallmark of PAD. Claudication is sharp pain in the calf that occurs during exertion and sometimes elevation of legs because of decreased perfusion resulting in lack of oxygen supply to muscles. Claudication is usually relieved by rest or dangling the legs, which restores perfusion. However, as PAD progresses, pain can happen at rest, and ischemic ulcers may result, commonly found between toes, which can be painful and lead to infection and gangrene. Other signs and symptoms of PAD include skin that is cool to touch and can appear pale, shiny, and taut with hair loss due to hair follicles deprived of the nutrients they need to grow. And toenails can become brittle because of the same reason. There are also delayed capillary refill, which is defined as more than 3 seconds to return, and diminished or absent palpable pulses. Interventions. Pharmacological interventions include lipid-lowering medications, such as statins to decrease atherosclerosis, antihypertensive medication to promote vasodilation, which improves blood flow. Antiplatelets such as aspirin and clopidogrel help to prevent cardiovascular complications, since plaques can break off and travel to lungs and heart and cause pulmonary embolism and stroke. Nursing interventions primarily focus on patient education. For example, diet modification to include more fruits and vegetables and consume low cholesterol, low-fat foods. Stop smoking because it causes inflammation to blood vessels, which makes smoking a major risk factor for developing and worsening PAD. Exercise regularly with low-intensity activities such as walking, cycling, and swimming. Stop if claudication develops and gradually increases the intensity. Referrals to physical therapists for exercises that can promote collateral circulation, which encourages blood flow in smaller arteries nearby that can provide perfusion. Inspect lower legs and feet daily for wounds, especially if the patient has a history of diabetes. A combination of both puts patients at a high risk for development of wounds in lower legs. Educate patients to be careful when trimming toenails, and for Nclex test purposes, toenails of patients with PAD should only be trimmed by doctors. Do not elevate legs because that would impair perfusion and worsen symptoms. No SCDs or compression stockings because compression would further impede arterial blood flow and perfusion. Do not apply direct heat like a heating blanket to the area due to decreased sensation and increased risk for a burn injury. Thank you for watching this video. Make sure to check out my study guides by clicking on the link in the description. As always, this video is for educational purposes only and not indicated for clinical use. See you next time.